All right, the National Asthma Education and Prevention Program, or the NAEPP, excuse me, NAEPP. And I do want to apologize that I do have some people doing some yard work outside the apartment, so there might be a little bit of background noise by me, Nicholas Riesenberg. All right, so the NAEPP, the National Asthma Education and Prevention Program, was initiated in 1989 to address the growing national health problem of asthma. And then according to the latest data, nearly 25 million people in the United States, including 6 million children, have asthma. And in that 25 million, I am also one of those. So what are the goals of the NAEPP? So it's to raise awareness among patients, health professionals, and the public that asthma is a serious chronic condition, to ensure the recognition of signs and symptoms of asthma by patients' families and patients and their families and the public, and the appropriate diagnosis by health professionals. Ensure effective control of asthma by encouraging a partnership among patients, physicians, and the other health professionals through modern treatment and education programs. Enhance the quality of life for patients with asthma, reduce the burden of asthma, and reduce the number of asthma-related deaths. So, and NAEPPC, so that is the National Asthma Education and Prevention Program Coordinating Committee. They developed clinical guidelines known as Expert Panel Report 3, or EPR 3, for diagnosis and management of asthma. Selected topics in the EPR 3 for the diagnosis and management of asthma were last updated in 2020, so really not that long ago. So we're still fairly current with that. So what resources have they developed? They developed and widely disseminated the guidelines for diagnosing and managing asthma in 1991, followed by revisions in 1997, 2002, 2007, and now most recently in 2020. And the most recent were in 2020, and they focused update to the asthma management guidelines, provided guidance on 6 selected topic areas. The NAEPP's formal National Asthma Control Initiative, or the NACI, engaged diverse stakeholders to bring asthma care in line with evidence-based recommendations. NAEPP and NACI resources for patients with asthma and their families and for health professionals are still available. So the NAEPP expert panel report the 3 their guidelines. Quality asthma care involves not only initial diagnosis and treatment to achieve asthma control, but also long-term regular follow-up care to maintain control. Asthma control focuses on 2 domains: reducing impairment, so that is the frequency and intensity of symptoms and functional limitations currently or recently experienced by a patient, and 2, reducing risk, which is the likelihood of future asthma attacks, progressive decline in lung function for children in reduced lung growth, or medication side effects. Because we all know with anything that's with a steroid, you can have some side effects over time. So the Asthma Care Quick Reference Guide, this is what they've developed, is the Asthma Care Quick Reference Guide for people to be able to look over clinicians and patients and families to have a greater grasp of where they're at and how to diagnose and manage the asthma. And the overall goal of that reference guide is to help clinicians provide quality care to people who have asthma, which is, always a good thing. So this picture is a little bit blurry, but I can work it through for you. So this is a diagram going over the initial visit for somebody who's coming in to be diagnosed with asthma. So initial visit, first step is to diagnose that they have asthma. And then after you diagnose that this person does have an obstructive lung disease, and this one being asthma, you're going to assess the asthma severity. So is it a mild severity? Is it moderate? Is it severe? Is it something that they're really struggling with? And then you're going to initiate medication and demonstrate use. And the medication will differ from whatever severity of asthma they have, which we'll go over a little bit later. And demonstrate use is a big part of this as well. We've talked about a lot. I know I'm pretty sure Mallory said that she knew a patient that was using their Spiriva through their nose. So it's important to demonstrate the use, because it's not a lot of these different inhalers, some of them being the steroid variety or DPI or the MDI, they work a little bit differently. So people do need to be taught and shown how to use that properly, so they are using it effectively and help to combat their asthma symptoms. So after you initiate medication and demonstrate use, develop a written asthma action plan. So now that you know how severe it is, what we're going to use to medicate, we need to make a plan of how we're going to use that medication and how we're going to maybe talk to that patient about if they have like exercise induced asthma, like what we want you to do in those cases. Like maybe I want you to take your albuterol before you exercise, you know, and what signs to be aware of if you might be having an exacerbation at that time. Just better preparing the clinician for what they're going to have to walk that patient through and what they may have to prescribe in the future, and also prepare that patient for what they may experience and how they should be effectively treating their asthma. And then last step in the initial visit is to schedule up a follow-up appointment, because asthma can be very progressive and most of the time is a progressive disease, especially if it's not being managed. So we want to schedule a follow-up so we can keep an eye on that progression. So follow-up visit, first thing you're going to do is assess and monitor asthma control. So we're going to see where their kind of baseline is at now. Are they seem to be on the right path? Are they in control of their asthma? Are they taking their medication right? Or are we looking at like this is starting to progress in the wrong direction? So after you assess and monitor asthma control, you're going to review medication technique, like we talked about already, is very important, and adherence. Assess side effects, review environmental control. So this is basically you're going to find out if they're taking their medication properly, not only in the demonstration and technique, but when they should be taking it. That's the adherence part of that. If are they adhering to their actual medicine regimen? Assess the side effects, see if they're having any negative side effects to this, or if it's not even working at this point. Because sometimes everybody builds a tolerance at some point to some things. You might have to adjust the dosage, and review environmental control. If they've been experiencing more symptoms, or you know, what have you been doing? Well, it's spring. I've been doing lawn work. I've been mowing a lot of grass. Well, maybe that's not something you do. Maybe you need to have a non-rebreather on while you're doing that. So know where their environment is and how assess if that's causing more issues to their asthma. And after that, we're going to maintain or step up or step down medication. So depending on how they're progressing, like, well, okay, you're in a good spot. You're not having any episodes, no exacerbations. We're going to maintain this medicine regimen because you're in control here. And if they're experiencing more problems and more exacerbations, you might want to step up the medication. You might need to add an ICS. You might need to go into those more moderate or severe categories, or just increase the dosage, or you may want to step down medication if it's like not only am I doing well, I don't hardly even use it when I don't really see a use for it. Well, maybe we want to track back a little bit because you might be doing a lot better than we initially thought you would be at this point. So after that step, you're going to review asthma action plan and revise as needed, because you made an action plan, but now this is a different visit. We're most likely maybe be at a different point in this asthma. They may needed, a step up in the medication, may need a step down. So we're going to review that asthma plan again and revise, how often you're taking it. Maybe you're going to take it more. Maybe you're going to do more than one puff this time. Maybe we're going to add a medication. Maybe we're going to step it down. Maybe we're going to want you to do it as needed. And maybe we're going to talk more about environmental control if you've found out more environments that you've been in recently that have been giving you more problem with your asthma. They may talk about how to avoid those things, because sometimes you can't avoid those. Like doing lawn work is something that a lot of people have to do. Not all of us have a luxury to be able to pay for someone to do that for us. So it's got to get done at some point. So wearing a non-rebreather or something like that, taking frequent breaks, not being out there for too long. So they'll talk about things like that in the action plan. And then the last step would be to schedule a next follow-up appointment, because this is most likely going to be a progressive thing, whichever way we don't know, but this is a chronic disease that needs to be monitored at all times. So we want to follow up and see where they're at with the next one. All right, thank you. This was the first video, and I will be going on with the next one very shortly.